and you push the blood that you use to waste for a blood draw back into your patient. So when you're drawing off a line, there's essentially two categories for the types of blood draws that we can do: a closed system blood draw and a non-closed system blood draw. A closed system blood draw is where we use some sort of vamp system or closed line system where you go ahead, you're pulling this little accordion here. This pulls the blood from your patient up to this little accordion box right here. You can turn your stopcock, draw the blood, and then push the blood back into your patient, because this blood was in a closed system. You were never disconnecting anything. You were never putting the blood on a table. You weren't exposing it to air. So in this method, yes, it is safe when you have a closed system like this to push that waste back into your patient. But if you are doing a traditional waste method where you're connecting your syringe, flushing the line, pulling back, getting that, couple milliliters of waste, setting it on the side, then connecting, your lab drawing, whatever you're using, syringe, Vacutainer to draw your lab tubes, you would not want to return the patient's blood with that syringe of waste. A couple reasons. One, it's not a closed system, right? Like when you disconnect these syringes, they're being exposed to the air. If you're setting it on a table or whatnot, potentially could be contaminated. Yes, I understand, like it's such a short time. However, we don't do things like that. There are nothing in these syringes to keep the blood from coagulating. And so if it's sitting there for a long period of time and getting injected back into the patient, risk for infection, risk for, injecting coagulated blood. It is not safe to do that. It is not the best practice. So closed system blood draws, yes, you can return your waste. Non-closed system blood draws, don't return the waste, discard it.